Tim McEllier, Celeste Ordaway, Joelle Steininger, and Jennifer Teague. So we do not have a quorum, but we will go ahead with reports. We're expecting Jennifer Teague to be here shortly. As soon as we have that, we can take some action on items if we're ready to do that. So, any questions about that from the committee? We'll hold off on the minutes until we have a quorum. Our community value for today is focusing on housing solutions. The COC system partners will collaborate to maximize all of the current resources and be strategic with new resources to ensure we are bringing on more permanent housing solutions. Any thoughts or comments about that? All right, so we'll go to the Homeless Strategy Division updates.
Good morning. We have been very busy in our division, as you might imagine. Want to share a few highlights and updates with you. If you want to go ahead to the next slide. So last week, 3 of our folks, Catherine and Debbie and I, attended the annual National Conference on Ending Homelessness. That is the annual National Alliance to End Homelessness conference. It's a wonderful learning opportunity. It sold out in 48 hours. There's such demand for people to be participating in this. It was, I think, about 1,000 folks from across the country. So really a robust conference with a lot of great information. Some of the themes that I think we heard are that unsheltered homelessness and encampments have increased significantly during the pandemic. That's certainly been true here, but not only here, really a theme across the country. And definitely clear messaging from HUD and from the Alliance that that as we continue to come out of the pandemic and as housing costs continue to increase, we are struggling to gain ground, and that this is an important moment in time for us to really work together to move forward. Providers are struggling with staffing shortages, need increased funding to improve retention. That was a definite theme that we heard. Obviously, staff retention improves client outcomes and community outcomes. A lot of focus on continued and renewed commitment to housing first principles and evidence-based practices. Just some messaging that what has worked for a long time does still work. We just need to bring that to scale. It's not currently at scale across the country. And then an increasing emphasis from HUD on valuing the expertise of people who have lived experience of homelessness, making sure that folks are seated at decision-making tables and provided with support and compensation. I know that we have discussed all of that. This board is certainly in alignment with that. And then also an increased need and impact means that there's increased attention on the issue and increased will to act in communities across the country. Very clear messaging that this is an important moment in our country's history and we need to not miss it as people who care about this issue. Just a great opportunity to garner additional support for solutions that we know will resolve homelessness.
So last meeting we had suggested board members look at the dashboard that the National Alliance posts on the state of homelessness, which is based on PIT data. If you go to that site, it'll give you a map of the United States. You can click on a given state and a given COC, and you can see metrics related to PIT data. And the question from the board was, what about age data? Because the graphs that we went over did not include age data. The National Alliance does not have age data on their dashboard, but because it's based on PIT data, this graph is based on what is HUD posts on their website for national data, and this is 2022. They do not have not yet posted 2023, but basically this is 2 graphs. The one on the left shows you adults only. The one on the right shows you adults with children. And the lighter bar is what we reported locally for Asheville Buncombe, and the darker bar is what is reported nationally. Overall, you can see it breaks it down: emergency shelter, transition housing, and unsheltered. And the age groupings that they have in 2022 are limited, but it's less than 18, 18 to 24, 24 and older. In 2023, the age groupings changed. But you can see overall there is some positive relative to national trends. Locally, our emergency shelter and transition housing is performing better nationally, but in the unsheltered area, there is less of a difference in terms of the national numbers. So the other,
Can we go
I'm sorry,
back?
yeah.
Can we go back to that chart real quick?
Just a minute.
So we have fewer people in than nationally in the sheltered group and more people in the unsheltered group. Does that, I mean, I know that we have some unused beds in our shelters, so I wonder if that's a challenge that we can acknowledge, that, you know, we need to move people between now and the next bid count from unsheltered to sheltered in some way.
That certainly would be in line with what I'm observing.
And families with children, our numbers seem really skewed for the transitional housing piece, but maybe that's a good thing. People are at least in transitional housing and not unsheltered. Okay, thank you.
Mhm. Are there any other questions? All right, so you may recall at the last meeting, we have proposed the idea of implementing sharing agreements with NC 501. Currently, we have significant restrictions for HMIS agencies and how they can view each other's data within HMIS. And so the structure in which this would be done is called a sharing CUSOBA, Sharing Qualified Service Organization Business Associate Agreement. And so today we'll be giving an update on the progress that we've made in looking into that and the interest level of agencies to pursue that. When we talk about sharing agreements, you get into privacy and security issues, which, you know, can get very complicated pretty quick. So I'm going to try to give some brief context. You know, ideally, this might be an issue wrestled with on a data governance committee, but as such, we did not have that yet. So I'm going to probably be giving you more information than typically in a board meeting. But first of all, why is sharing data beneficial? And that was a question that had come up at the last meeting. And HUD does have a paper that they've posted on their website where they describe the Corporation for Supportive Housing has done a review of 25 studies between 2002 and 2017 regarding sharing of data. And they found that it reduces utilization and cost associated with emergency crisis for single adults with chronic disabilities. So even though these studies were about communities that did much more advanced sharing than what's being proposed in this CUSOBA, it does show quantitatively that the quicker that you get people housed, you reduce the expense and cost on your emergency services. Sharing data also provides a secured location for agencies to share their housing-related documentation. It assists agencies to avoid duplicating work of another agency. It can reduce redundant paperwork for clients and staff, especially around the ROI, the release of information that clients are asked to sign, which is reciprocal in the sharing agreement. So that means that if Salvation Army gets a client to sign an ROI and that client goes over to Haywood Street doesn't need to have that client go through and sign another ROI. And it also utilizes the better design, the design of community services for agencies to monitor data quality issues. There is, as you probably can imagine, a lot of variables that are unpredictable when you're trying to track client interactions. And if agencies are unable to see each other's data, then their enrollment and exit dates can overlap, and that's an issue that is a data quality issue that HUD has concerns about. So what does HUD require around privacy and security? HUD has in place guidelines for protecting personal identification information. That would be things like name, gender, year of birth, last 4 years of social, and their veteran status. But HUD also includes a reference to protected health information, PHI, which is related to HIPAA. And for those of you that are aware of HIPAA, those are very strict federal guidelines about how information can be shared. HUD does not consider a COC as an entity under HIPAA. So that the reason they value HIPAA, because it's a national standard that's commonly known, but it is not something we are required by law to follow. Community services, that's the HMIS software that we use, isn't intended to be an electronic health record. So we are not documenting psych evals or lab test results or prescription medications. That is not information that's being collected, which would be examples of what's covered by HIPAA. However, there is a little bit of overlap between HUD, community services, and HIPAA, and the PHI that we primarily collect is self-reported mental and physical health issues and limited health insurance information. Self-reported mental and physical health would be like depression, substance use, HIV infection, and the reason those questions are asked is because a caseworker, it gives a caseworker some indication of what programs or services that client could be eligible for. However, HMIS had to make very clear HMIS should not be used to verify eligibility. Caseworkers still have to do due diligence to confirm someone's actual eligibility for services. So HUD expects us, the COC, to identify where we're going to draw that line when it comes to overlapping privacy and security with HIPAA. And primarily that's going to be the release of information and the COC's privacy and security policy. So what is this COC, NC 501's privacy and security policy? NC 501 is contractually part of NCHMIS, and they are the ones who have set a standard for privacy and security policy, which includes HIPAA's requirement agencies must disclose to a client what data is collected and how is it shared. This is a map of the COCs in North Carolina. You can see the majority of the state, is that light green color, falls under balance of state, and then the individually colored counties are the different COCs, which are largely around urban areas. The counties circled in red are the ones that belong to NCHMIS. So these are the counties that we have a shared database. We use the same software. We cannot see each other's data, with the exception of ABCCM, who runs veteran services for the Carolinas, and they serve more than one county. They're the only agency that we have that is in more than one county. So in that respect, you have one agency, one program. The fact that they're in different counties doesn't matter in terms of visibility for sharing data. I will add that Charlotte-Mecklenburg was part of NCHMIS. They left just a couple of months ago. They implemented their own HMIS software, and Raleigh-Wake County was also part of this group, but they left earlier in the year and implemented their own software. This is a list of the COCs that are in the state of North Carolina and whether they have sharing agreements. So right now, Asheville-Buncombe and Northwest COC are We're the only two that do not have sharing agreements. The reason Northwest does not have a sharing agreement is because, and they're the ones located in the upper left corner of the map, is because they had so few HMIS participating agencies involved that it was not worth the admin burden that comes with executing a sharing CASOBA. And there is a certain admin burden that comes with executing and maintaining that. I will mention balance of state, which is the largest one. They break their areas up into regions. They have limited sharing, and what that means is their coordinated entry, which is the interview process that someone who is homeless initially goes through to start beginning to identify where to direct them in terms of services and needs. They do share their coordinated entry data. They are more restrictive about some of the assessment data that's collected once someone gets into the homeless system. So what do we currently do? We do have an ROI, and we also have what's called an HMIS, release of information, and we also have a CAM or VCAM ROI. The CAM is coordinated assessment meeting, and those is the group that will meet and review a client's data and try to prioritize them and find a slot for them for housing. So a client will be asked to sign a CAM ROI if they're seeking housing, but not all clients sign a CAM ROI. But basically, our HMIS ROI currently has two sections: basic identifying information, which is primarily intended for performing searches to minimize the possibility of having duplicates in the database. And then they also can share relevant assessment information. So it's asking the client if they're giving the agency the ability to share that information. Once they've collected that ROI, the HMIS client data can only be seen in community services by the agency that entered that data, outside of basic identifying information. A client can also request that the basic identifying information also be suppressed. The non-HMIS agencies and the HMIS agencies other than the agency working directly with that client only become aware of HMIS client data via paper forms or verbal sharing, such as during case conferences. And these are the list of agencies that we have on our CAM ROI, which is what we're telling the client. These are agencies that we may work with in order to help secure you housing or supportive services. So what will change with a sharing agreement? First of all, we're going to modify the security settings so that a sharing CASOBA agency can see each other's data. And this is a simple example of what that would look like. Basically, an HMIS participating agency that currently uses community services like Homeward Bound, they can see that they have a client that enrolled in their city outreach program. They were out on the streets, they contacted a client. The client is interested in working with them, and so Homeward Bound goes in and documents that, and they started working with that client on, in this case, January 2021, and stopped working with that client in March of 2021. During that time, Homeward Bound is going to be collecting assessment data on that client. With a sharing CASOBA, what Homeward Bound will see is that this client had 2 care periods with Haywood Street, once prior to City Outreach getting involved, and then once after City Outreach was involved. And they would also be able to see that client's assessment data that Haywood Street collected when they were assessing that client. The other thing that will change is to implement a new ROI. So the proposal is to merge the current CAM ROI and the HMS ROI into one document and utilize the ROI, its capacity within the sharing CASOBA, to function as a reciprocal document with a span of 5 years and update the wording to address readability concerns from a client's perspective. So what does that look like more specifically? So the ROI has 3 sections: basic identifying, acknowledgement of rights, and then the third section, coordination of care sharing plan. The third section is the one that has the most changes. The other 2 sections are fairly nominal. in terms of changes. So one of the key changes that we're making is we're going to be listing who the HMIS participating agencies and programs are. We also from the CAM ROI, we're adding the non-HMIS participating agencies. A couple of points about the listing of these agencies. We are also attempting to expand our relationship with RHA and Via Health, who have both expressed an interest in being able to have view-only access to HMIS. As you know, the RHA Jail Diversion Program has staff based in the Buncombe County Jail, and this allows them to be able to go into HMIS and find out what agencies are working with these clients that are coming onto their radar. Of course, you know Via Health is also involved in finding housing for homeless for those that they work with.
A couple of questions.
Yes.
I don't know if this would be that specific. I have lived experience, and that is my voice on this committee. But when I was homeless and applying for services, Via Health, when doing their intake, asked for the score on my VDAT. And I didn't know it, nor did I know how to find it. So I would just think there would be a benefit to sharing information with Via and RHA.
The VI SPDAT is part of the standard assessment, so those scores would be viewable by Via and RHA Jail Diversion. There was another question?
That's it.
Okay. So the second part, that is the section 3 that is changing, is we're listing the data elements that are candidates to be shared. And one of the things that I want to emphasize is twice on the ROI, it says the client does not have to provide information in order to receive services unless an agency is working with more than one agency. They're trying to collaborate services, and when they collaborate services, it could be a requirement for them for that program. But generally speaking, especially with a client working with a particular agency, they are not required to provide this information, but this is a list of information that we would potentially collect on them and would potentially share with other agencies if needed and relevant to their care. And I'll go through this list just briefly. We've got coordinated entry assessment, contact information, contacts with a case manager, current living situation, date of birth, domestic violence, household income and benefits, household member names and relationships, housing and homeless history, area currently residing, last permanent address, self-reported physical developmental or mental health condition, participation in homeless services, if they exited a program, why they left, and the reason, where they went, their destination, race and ethnicity, referrals and other service connections, services received from other HMIS agencies, their sexual orientation, which this is a new requirement that HUD is implementing on October 1st, specifically around permanent supportive housing, social security number, type of health insurance, and our medical assistance and veteran status. And there are two separate subgroups, veterans and youth, listed below that. And that's because there are questions that are asked of veterans and youth that are not asked of other clients who are non-veterans or do not fall in that age group. One of the things that's not on this list is case notes. We specifically made the decision that case notes would not be shared. Generally, the guidance is that caseworkers should not record private, confidential notes about a client. They can, but there are some times where we looked at the notes, agencies may share, may record information about substance use treatment or interactions with law enforcement. So the decision at this point was that we would suppress case notes for now. What doesn't change with this privacy and security rollout? Clients are not required to provide the information requested in order to receive services. Clients and agencies also will have the option to suppress a client's information. So if the client says, yes, I'll give you my information, but I don't want it shared with anybody, then the agency has that option to do that within the software. The agency, at their discretion, may decide to lock down a client's record, and that being, for instance, Elida Holmes, who's working with children who are under 18, would automatically, as a normal business process, lock that account down. Now, once that child becomes an adult, they'll have the ability to unlock their account if that client so chooses, but the information that was recorded while the client is locked down, record is locked down, will not be viewable except for by Elida Holmes. HMIS users are still required to take annual online privacy and security, and we monitor that in terms of what their recertification date is, and if they have not met their recertification date, we inactivate their login. The city's Homeless Strategy Division will still conduct annual HMIS audits with each individual agency for compliance. There is opportunity for development there, which hopefully a data governance committee will also be able to help with. So what are the results of our survey? Asheville City Legal has approved the language in the sharing CUSOBA and the updated ROI. Feedback was solicited on the ROI from the Coordinated Entry Work Group, the Coordinated Assessment and Veteran Assessment Meetings, those are the CAM and the VCAM, the housing groups. And so far, 8 of the 10 agencies who are candidates for participating have agreed to join the sharing CUSOBA. The other 2 still have it under discussion, and I have not heard back from them yet. Our implementation timeline, this is what we were presented last month. It's pretty much on track. We are presenting our findings, but today is not we're not requesting a vote today. That will be in the August meeting, but we still should be able to be on track, assuming that we agree to pursue this, to execute the CUSOBA on October 1st. The main justification for that is the HUD year. It starts on October 1st. HUD does data standard changes every 2 years. When they do data standard changes, that means we'd have to execute a new sharing CUSOBA potentially, depending on what the changes are. And so this maximizes executing, as you can imagine, executing a new sharing CUSOBA is very involved. It's not a simple process. So we maximize our use of our current sharing CUSOBA for 2 years before HUD comes out with new data standards.
Thanks, Charles. Any questions? You don't need any action from us on this today?
No.
And will it come back to us for further action, or are we good to go?
Yes, the policy and the CUSOBA will be on your August agenda for a vote.
Which is in, our August meeting is going to be in 2 weeks, just so everybody's aware of that. Okay, we're running a little behind, so quick update from boards and commissions on hybrid meetings, if we have that.
Yes, briefly, the Equity and Engagement Committee voted unanimously to move all boards and commissions all meetings to a hybrid meeting format. Once that's implemented, that'll be true for both members of the board and for members of the public. It will take a bit of time to roll that out. We obviously have a governance work group that's actively moving this continuum of care board out of the boards and commission structure, so this may not end up applying to this body, depending on the timeline, but we'll continue to share updates as those become available from the communications folks at the city.
Great, thank you. Let's go back and approve the minutes, if I could get a motion on that. Is there any questions?
A second.
All in favor?
Aye.
Any opposed? All right. Next, information pieces on the Community Responder Initiative.
Good morning. morning.
Morning.
I'm Assistant Fire Chief Patrick Crudup, and I'm the Program Manager for the Community Responder Program. So I'm going to give you an update on the program, what we've been doing, and where we're heading. We started the initiative, and thank you for inviting us. We started this initiative on May the 1st as part of the Downtown Safety Initiative. The plan was to run that initiative for 60 days and collect some data and see what we're going to do moving forward. The responder group is 2 to 3 firefighters working 7 days a week from 9 to 9. So occasionally we'll make adjustments. We may come in before 9 or we may go later than 9, depending on what we need to do, what's happening in our community. We've had some successes in building relationships, using a proactive approach, going out and meeting people in the spaces where they are, and collecting data and providing some needs and resources to them. We're going to be continuing to evaluate. We've heard from internal and external stakeholders that the program is going well and the need to continue that program. So right now what we're doing is kind of building that program out and gathering some information to push to our city leadership to continue and see which direction we need to go with that program. We're going to continue to work with the Homeless Strategy Division, and our goal is to fit into the overall board which you have here going on, and to be a cog to see what we can do to move the needle forward or providing additional services. That's basically the responder program. So what questions can I answer for you?
I really appreciate the work that you've done on this, and I wanted to share with you that I did call community responder. There was a man passed out. I couldn't tell if he was dead or breathing, and I did call and stay with him until community responders got there, and then they took over. So I think it was a very positive experience for the general public.
Yes, ma'am. Thank you.
And I'll mirror that same sentiment. The folks have been stopping by the A-Hope facility pretty frequently and actually engaging with folks and providing some good feedback for us and our staff, and just being a lending hand, so we do appreciate that as well.
Yeah, thank you, Marcus.
Since my first year here, I've been wanting this, so I am very happy to see you here.
Thank you.
Or you said 9 to 9 a.m. to 9 p.m., I assume, not overnight.
Not overnight, yes, sir. 9 a.m. to 9 p. And sometimes we come a little bit earlier as they're working at 9 a to 9 p. If they identify any kind of trends where people are showing up later, they will make their adjustments. And currently, we started in the CBD. We've expanded west now some. So our plan is to expand that program outside of the CBD and continue in the CBD as well. What's happening now is, as we expand, as I said before, we have 2 to 3 individuals working 7 days a week. Our challenge is being able to sustain that. So we're developing a plan for sustainability of the program.
Go ahead.
Do you have social workers on your team, or is there a plan to include social workers on this team?
That's part of our plan going forward, to identify other personnel that we may need outside of the firefighters to be a part of that team.
So that would be collaborative with other agencies, or you would hire social workers in the fire department?
We could collaborate or possibly hire. It's something we're going to look at and try to push through.
Seems like a good opportunity for collaboration.
Yes, sir.
I just have,
Go ahead.
just to clarify, the firefighters that are on the team are paramedics?
They're advanced level, so we operate at an advanced level.
How many team members are you working with?
Currently 5.
And are they overtime members, or are they specific
So
additional members? Or
So the 5 that we have on the team, with the help of our Homeless Strategy Division, they were selected through a process. So they volunteered to come off the fire truck to be a part of this program and serve the population. So those 5 were the best of the 18, 20 people that we had to apply for the position.
thank you.
Other questions?
Can I I just want to say a big thanks to the fire department. It's been really wonderful for our division to be able to collaborate with them and to let us be part of this. I think we want to be sure, as you said earlier, we want to be sure that this kind of effort gets integrated with the work of the COC and doesn't happen kind of in a vacuum separate from this overall systems work. And they've been really wonderful about partnering in that direction. It's exciting to have this new capacity on the horizon.
Yes.
Are you all mirroring this off of any other projects that are happening around the state?
So Durham has a project that we're looking at now. We started looking at it in the very beginning. We've circled back. Another assistant chief was in Raleigh doing some business, and he gathered some information from a project in Durham. Durham's program, they don't use firefighters as much as we do. There's like a whole nother division. So it would take some work for us to get there. But we are looking at them, as well as I think we took a look at a program in San Francisco, maybe.
I think Guilford is running something similar. It's not exactly the same, but I just heard about that recently too, and they're doing it out of their county, but they've brought together like fire department and social worker to kind of meet those holistic needs. So I just want to put that one out there as well.
Thank you. We'll look into it. Thank you.
Would that be the Heart Project?
I think it is. I think it is what it's called.
I think that project looks so wonderful. Yeah.
Okay. Pull the mic down.
Just a clarifying question, because the Durham Heart Program runs through their community safety department. I heard you say an advanced position in response to a question about the community paramedics. Could you explain the difference between the two and if you've identified any needs in those gaps?
Yes. So when you look at medical services, the EMS services, you have a basic level, you have an advanced level, and you have a paramedic level. So where our department operates is that middle level. Once you get to the paramedic level, those are, they're able to push certain drugs and do certain procedures that you may not be able to do at the advanced level.
The advanced level can administer Narcan and that.
That's correct.
Okay, yes.
The basic level can administer Narcan as well.
Any other questions from the committee? Thank you, sir. We appreciate your support.
Thank you, Mr. Nash. Thank you.
Okay, where are we with time? We're behind, but we have a coordinated entry interim policy addendum. See if we can move this one quickly, if possible.
Certainly. So I want to give you a little bit of background on this priority placement addendum for domestic violence survivors. As you know, the coordinated entry work group is evaluating every kind of element of our system, and we'll present HIAC with recommendations as we move through that. When we were reviewing the policies and procedures for prioritization, we determined that the current policies don't account for the unique needs of people fleeing domestic violence. Currently, our prioritization is based on length of time homeless, followed by the VI SPDAT score. So as you can see, folks fleeing domestic violence don't often have that longest length of time homeless due to the nature of their experience. And so their vulnerability is better determined by the danger assessment, which is a national tool that's used to predict lethality risk for those survivors. So our COC resources, as you know, include rapid rehousing provided by Helpmate and dedicated to survivors of domestic violence. And so currently inflow for that rapid rehousing project is coming through coordinated assessment meeting and coordinated entry, and the prioritization for Helpmate's rapid rehousing program has been no different than general population. So the recommendation is that we adjust our priority policies. The work group looked at this with the help of staff and developed this new suggested priority for folks fleeing domestic violence and rapid rehousing that is dedicated for those survivors. And so first priority would be people with the highest danger assessment score. And if there are multiple people that have the same danger assessment score, then the second priority would be the greatest length of time homeless measured in months, followed by the vulnerability measured by currently the VI SPDAT. So I think that is a basic overview. Do you all have questions?
So this new prioritization will just apply to people fleeing domestic violence?
Yes,
Or survivors of domestic violence?
yes,
Otherwise, the prioritization will continue the same for other groups?
yes.
And
Pending,
it will apply to services that are specifically designated for people fleeing domestic violence?
correct.
All right, any questions about that? Or can I have a motion?
Help me understand this for clarity purposes. Are there separate, is that a separate access, like a coordinated entry system for individuals fleeing domestic violence, or?
No, so HelpMate and their programs participate in our general population coordinated assessment meeting that includes everyone in the community outside of the veteran population. Yeah.
I would say it's more like a lane within a common system, a common coordinated entry system, where eligibility for those dedicated those projects that are dedicated to people fleeing domestic violence, that has that specific eligibility overlay, but it is integrated with the whole system.
I'm wondering, I think where I'm trying to get to is I'm wondering why the committee is focusing on this one piece, because I thought there was a conversation to be had about the whole picture.
Yes, yes. So I think that the coordinated entry work group will be making a recommendation at some point in the future as that group continues to do their work that may adjust prioritization for the general population as well. It's that our policies, our current policies and procedures do not allow for this unique population currently. So the group felt the need to implement this now so that we have it and can continue the work when we get to prioritization. So this is kind of an interim policy for now.
Because you have nothing in place at all.
Right, correct. They are.
Because you have nothing in place at all. I just want to-
Right,
For this population?
right, for this population, they are being considered the same as folks that have a long period of time homeless, and that doesn't accurately reflect their needs.
Can I get a motion?
I just want, may I add something before we get a motion? So that when or if this policy doesn't work, we can change it again, because we need to put something in place in general.
If it doesn't work, we can change any policy.
There we
of
go.
course.
So let's put something in place.
Just for clarifying, I anticipate questions from the public about this. Why are we using domestic violence versus intimate partner violence?
Can I let our local domestic violence expert speak to that? Yes, come up and use the mic.
Thank you, Kim.
Yeah, so just to clarify the question you had, so the breakdown as far as DV versus IPV. So in the like HUD category for homelessness, which y'all know all about, so I don't need to bore you with that definition, does break that down into more specific subsets as far as human trafficking, sexual violence, that may not even be related to an intimate partner, but as helpmates, specifically the folks who provided some insight and guidance around this interim policy, we specifically serve victims of intimate partner violence. There are other organizations in the community, of course, that support folks who are in those other, right, subsets like Our Voice, for example, for human trafficking and sexual violence. So our organization does kind of sometimes conflate the two, DV versus IPV, but to be specific, we do support specifically victims of intimate partner violence. And so there are some, I guess, there's meaning behind those definitions, certainly, and the way that this shakes out. And I guess there is further clarification around the fact that, like, the danger assessment score does need to be administered by somebody who is certified to be able to not only score that assessment properly, but also provide accurate safety planning based off of how they are scored and what their lethality risk is, which is something, of course, that all of our staff are set up to do. So in some way, I guess where I'm going with that is that they will be, unless there's cross-training, which is part of our goal, right, in the future of our coordinated entry system, right, so that more folks outside of Help Me have the ability to administer the danger assessment. But they would have some sort of interaction with our organization, whether it's us being the folks who are presenting them in our coordinated entry meetings, or if they're being referred by an outside organization, which is not uncommon as we currently are operating in CE right now. I don't know if that answers your question, but.
What I'm hearing you say is that it's underneath an umbrella.
Exactly. Yeah. Any further question?
You confused me, so I'm going to say it.
Okay.
Try as simple as possible. For
Sure.
purposes of this process, is there a difference between domestic violence and intimate partner violence?
There is, yes. The danger assessment score specifically pertains to those who are experiencing intimate partner violence and not familial violence, which is what most people think of when they think of DV, which is the larger umbrella.
Okay.
So,
So DV, we are including the larger umbrella, which does include intimate partner violence
correct.
for this policy. Are we good with that?
Does that, okay.
Jen?
Are these priorities considered best practice? Like, do other COCs use the same priority list?
So that's a great question. I wish I had a reference for you. I think that's something that we're still actively in. We haven't even really gotten to that point yet. We're still on the access chapter of, and I don't want to jump ahead, part of our action plan and our CE work group. So we haven't really gotten into the prioritization. What we have used to inform this interim policy is what we see currently playing out in our COC, which is that the HUD definition of fleeing and attempting to flee is not currently reflected or supported by the prioritization as it stands right now. Because also as HUD defines, right, somebody who is in a unsafe, their primary nighttime residence is unsafe due to an abusive partner, that should not be considered safe and stable permanent housing of choice. But also for folks who have recently fled, right, their length of time homeless, maybe 3 weeks, right? But their lethality risk is a 32, which means that they're at the top, right, in terms of their imminent risk to their physical being. So this is a way for us to be able to capture and reduce the harm to that person and therefore to the community.
So local decision regardless. So does the coordinated entry work group support this?
Yes.
You want to make a motion?
Just to clarify, this is coming from the coordinated entry work group. So this is staff supported, but this is a work group recommendation.
Yes. And I'll make a motion to approve.
Second? Second. Any further discussion?
Thank you. Next person.
All in favor?
Aye.
Aye.
Any opposed? All right. Work group progress, coordinated entry. Be
Okay.
quick.
All right. Okay, so we just did the DV policy. That's one of the things that we've been working towards as an accomplishment. We're also currently working on a draft for outreach policy and how that feeds into coordinated entry. One of the challenges that we see and one of our upcoming focuses will be to work with the outreach and encampment group on that coordinated entry policy for outreach, specifically around what practices outreach will take that will feed into the coordinated entry process to make sure that individuals who are not currently receiving services in a traditional manner will have the same opportunity to participate in that process as we move forward. We have some new membership with lived experience in specific, as well as some coordinated entry experience. We are currently reviewing information of the sharing agreement, and I believe Charles mentioned that. And we've done consultation to overcome language and cultural access barriers. It's been a really big conversation about the lack of equity that comes up and the fact that we don't have a lot of minorities that are participating in the coordinated entry system at present. So our focus moving forward will be to make sure that we do look at that equity piece in coordinated entry. Potential challenges that we see right now, language barriers and cultural barriers. Our needs, our partnership in underserved communities and multilingual outreach marketing efforts and multilingual efforts in general. And we will be looking at interacting and completion of tasks that involve standing work groups, completion of coordinated entry access review, which we hope to have done within the next couple of meetings, and begin our focus on our assessment and then prioritization review.
Any questions? One thing I want to say to all the work groups is we need you all to report out whatever progress you've made by our September meeting. We may need to, due to different reasons, we may need to start looking to restructuring. And not everybody is complete with their process, I understand, but we do need to get some kind of, let us know where you are and what remains to be done and what policy recommendations you have, if any, by the September meeting. Okay, moving on to governance. Jen?
We have continued to work on membership, board appointments, what that structure will look like, reviewing other charters, and development of a draft charter for this group. You all hear a presentation in just a moment from Rick. Our challenges continue to be very similar, which is numerous options, competing priorities, and differing of opinions, but it's led to really good discussion. Then needs time to continue to work on the charter, discuss and formalize draft recommendations, and then we have a memo for you and a presentation.
Thanks, Jen. So thanks to High Court for engaging with us. What we're going to give today is a brief update and then our plans for board membership, which we would like your feedback either live if we have time or in any way to us so that we can go on to the next step. Continuum of Care's federal program, community-wide commitment, full membership body, board established to act on behalf of the full membership and lead agency selected by the board. We started with the board because that is the key place we needed to have agreement and we needed to have a strategy. To remind you, the National Alliance recommendation was formally establishing a membership body of stakeholders to promote community engagement and ownership and restructuring the board outside of the city of Asheville and Buncombe County board structure. We are continuing along that path. Can you go on to slide 3, please? So you will see this slide continually from us as we move down this path. It's a pictorial that explains where the board is and how we see committees and the membership in total. We believe that the board needs to be filled with decision makers from the community and from the organizations that have a large stake in making this happen. And you don't have to read in detail all the stuff in the top blue because I'm going to break that down into the left and the right as I go on to the next stages. As a reminder, the board sets policy, creates committees or work groups as needed, monitors the progress of all COC activities, and revisits the charter on a regular basis. One of the challenges this team has is we are reviewing charters that are many years old and have gone through dozens of improvements over the lifetime of those charters, whereas we're starting fresh and we're going to have new people, and that's one of the reasons the conversations are so good and so strong. All the COC charters we've reviewed, COC is where recommendations are approved. Clearly, the board is the decision-making body that takes the work from so many others to make it happen. One thing that is clearly different from this than the way HIAC operates today is the sort of pink box around the whole thing, which shows that everybody who's in here is a member. And that extends to affinity groups, individual members, all of the COCs that we've evaluated and their charters make a big effort to get the broader community engaged and active and part of the work and the decision-making and that sort of thing. So that's very critical. Next. So this is just the left-hand side group. I just call them group one. One thing I want to make clear here is we had lots of debate about whether we would name an organization that fulfilled these categories, like name a faith organization or a business community representation. We decided as a team that we needed feedback from HIAC and the public that these were the right types of organizations to lead this. And then after we received that, then and only then would we start our outreach to the people we think from these organizations who would be the strong leaders that are necessary to really make this work. So what we're really asking for your feedback on, do we have the right categories of organizations, businesses, governmental organizations that need to be in this board in order to make it effective? So you see we have group one, lived experience, homeless response providers, business community, faith community, community at large, that we want to make sure that the neighborhoods and the population around these challenges that we have are engaged and learning how this all really works. One of the challenges will be just exactly how many from these categories we can actually see. It's always a challenge in the makeup of a board. The larger the group gets, the more difficult it is to make progress and to get things done. And I think we're all very hopeful that we can recruit people who can dedicate their time to this and we can take action and make the changes that are necessary to be more effective quickly. So that will always run in opposition to getting a board that begins at 20 or 22 or 25 people. Once we've conducted interviews with candidate organizations, we'll be in a better position to make better recommendations on that. We need your feedback on this, and there's the questions are at the bottom that you should consider. Is any organization missing that you think has a huge impact and would be a strong decision maker in this sort of thing?
I'm wondering if some representatives from libraries might be helpful, not necessarily regarding books, but as a community place for those experiencing homeless to hang out.
Okay. Oh, that's a bad time. Sort of opposite of the first question, who might be missing, do you see anybody in this group that you think shouldn't be in the decision-making category? That doesn't mean they don't contribute, because there'll be committees and work groups and hard work will be done and strong recommendations will be made, and those won't be filled by board members alone. Those will be filled by experts throughout the organization. And then finally, how should these organizations be nominated and what's the electing body? We have seen in our studies that sometimes the board does the electing and the voting, and we've seen also other COCs where the general membership is part of the electing community. Let's go one more slide. So this is the second group. Here we have a combination of large organizations and government organizations. Housing Authority is key, since that's a channel for housing at the appropriate time. Healthcare, behavioral healthcare, private philanthropy and funders. We all have talked a lot about how much money is actually needed above and beyond federal, state, county, and city funds. And we're hopeful that we can build some sort of consortium that will help consolidate the kind of funding that is necessary and make sure that it's going to the places that the COC sees as the highest priority. VA, of course, because that's a big part of our community, county, city, both staff and elected members. And specifically there, one of the things we need feedback on for elected members is whether they should vote or whether they should simply advise. And we have seen both examples in other COCs that we've evaluated. So again, any organization missing, any that shouldn't have a seat at this time. And then your feedback, please, on vote or advise. So we need your feedback. You know, we put a lot of hours into this to try to get things done, and it's going to get harder as we try to make appointments with CEOs and the mayor and county commissioner and chairs and that sort of thing. And we need feedback from the HIAC members that you believe we've got the right list of places to go, so that when we go there and we do a good job selling the value of these people pulling together to really make this thing click, that it sticks. So we will then go out and have these conversations and see if we can get the decision makers of the quality and experience that we're looking for. And that will give us clarity on who our first group of candidates would be for the board. While we're waiting for those meetings to proceed, we're going to start doing work on committees and work groups, and we've done some of that work since we finished this presentation. We had another meeting, and we got to some committee work, and we have done substantial work on the full charter. It's kind of based on Houston's, not completely, but it was the most complete of the three that were recommended to us, and some of the work is pretty just rote. You know, there needs to be certain kinds of policies and procedures that I don't think will be require as much debate as some of the harder work that we've already done. And then we'll bring it all back for feedback and a vote. Questions, feedback?
I have a question. Just clarification on the size of the board with the new structure. I'm not sure I understand how many seats we're adding or considering.
So the final number we're sort of holding in reserve until we start to get feedback from the candidate organizations and see what their enthusiasm is, and frankly, if they're willing to assign a decision maker, you know, somebody with the kind of not only ability to represent their organization, but to think broader and to then pull in other big players who can really make this kind of thing happen. It's going to be a tough balance. I see this going anywhere between 15 and 25. And the good thing is it's just going to be a start, right? If we put 15 people in place who are motivated to do this, 1 year later they can decide to make it 23 or 12 or whatever the right answer is. Anybody else?
Elvia.
I think that was kind of the problem with having branding with the larger organization. Let's just say we took on, you know, an agency that has 1,000 people in it, right? Then they have 1,000 voices. It kind of takes away from, you know, a smaller organization or a smaller community. So we tried to take out the branding of adding a specific organization and saying that they were going to be represented over, let's just say, Asheville in general. So we're trying to give the power back to the people here. So we took out all the names. So it's Asheville. So now Asheville can build Asheville.
Can we go back to the first list? All right, so are there any comments on this list as far as sort of general types of members that should be included? I don't see a number with any of them. Are we considering multiple individuals with lived experience?
Initially, we thought 2.
Again, that all of these faith community members, supportive services providers, there can be one in each, there can be three in each, there can be none in one if we can't find the right people to do the work who are willing to sign up. And one of the things I forgot to mention, I had never put it in my slides, is that anybody who is a member signs on to the goals of the COC, right? So the goals of the COC, which we've started through all of the work that Hayek has done, you sign in to be a member, you commit to those goals. What you're there for is to help us reach those goals, and that's where the debate exists. So part of this process will be finding people who will agree to sign up to those goals, right?
Right.
And so we need people who are all in. And that will determine whether there's one community member organization or two, and whether there's one or four supportive services providers. And again, we need to start where the first instantiation of this can actually get off the ground quickly, because we can't afford any downtime once we've appointed people and we have a charter.
And
You know, I'll withhold most of my feedback until I, can see the whole policy, but I think this is a wonderful start. And I know the first slide had, it had work groups and standing committees below. And so I would, my feedback now would be to go with a smaller board in light of what you're saying about how difficult it is going to be to get started in identifying these people. Obviously, there'll be opportunities to amend the bylaws and find gaps, but I also think those standing committees are going to be where a lot of the work is done, right? When you think of the new board not having so many service providers, but rather people who are connected to decision makers, able to help us bring the funding that we're going to need to provide the services. So I think this is a good start, and I love the idea of the community really being involved in those committees and getting a powerful continuum of care board from the start. So
Thank you.
any other thoughts?
I just would ask, feedback, I think certainly welcome all throughout the process, but the work group will meet again on Monday. And so if you have additional feedback, it'd be really helpful if you could send that to me and I can share it with the group prior to Monday morning.
So I have two items of feedback. One is, I think the list is excellent. I can't think of any groups or constituencies that should be added or taken off. I believe the elected representatives should vote and be a full part of the governance board. And if not vote, they should definitely be there. It's critical that we have both city and county staff and city and county elected officials in our meetings on a regular basis and voting. The other thing is I think we need to maintain some level of continuity, and I know that some people have already submitted their resignations from this committee or plan to, and that's fine, but I think the initial transition board at least should include everybody from this committee who has been active and wants to continue to participate, so I'll put that out there.
I would like to add as well, with this second group or board, there were some issues with having trust, et cetera, stakeholders, et cetera, donors, voting. With their intent or positions of possibilities of looking like lobbyists, we weren't sure that others would allow them to vote or want them to vote because of that look or feel. We already have a government that looks like that. And I wasn't sure that anybody else in Asheville would like that. So that is why we placed those with opinions who would like to donate to this cause. We would like you to be able to do that, but I don't think voting is proper to have the ability to do both.
For clarity, we left that as an open issue for further discussion. There was definitely opinions on both sides of that. So when we come back, after we have talked to candidates to be in that, I think we'll be in a better position to know what it will take for them to make an impact and to participate, and we'll bring that back through the working group.
Yeah, I have one other thought just on, in terms of structure and process, is that, we should have a governing document drafted and that we're comfortable with before we invite new people to participate on that. I think it's important to have it in place and have those things settled. Any other comments or questions, feedback to the committee? Kim?
Can I clarify that you're suggesting we have at least a draft charter before we do outreach? Is that what I'm hearing?
Yes.
Thank you.
I mean, and a draft charter that the HIAC is willing to recommend at least, I think.
So I'm taking that as input into the working group, not as policy at this stage.
Yeah, it's input, sure. But I mean, we can look back at the charter for the work group to make sure that we're being consistent with that, but my memory at the moment is that it was to come up with a new governing document. So, and you may want some additional voices or additional individuals involved in that recruitment effort, not just the work group. Any other questions, comments? All right. Outreach and encampment.
Sorry, we have another item on the governance work group.
Oh, okay, I'm sorry. Appointment of a new work group chair. Jen is stepping down from the work group and from the HIAC after this meeting, is that correct?
That's correct. The work has transitioned within Buncombe County from our department within HHS to community development, and the new staff will be hired very soon, and so we hope to be able to announce that. And so it's the time for me to transition out and community development to take this work on.
Okay, and I believe we've talked with Lance, who's a member of the work group, about being the chair. Do you all have any questions or concerns about that?
Perfect.
So I'll make that motion that we approve Lance as the chair of the governance work group.
I'll second.
All in favor?
Aye.
Aye.
Any opposed? Sorry, Lance Crawford, if there's any question about that. Outreach and encampment.
So we've met a few times since our last meeting, I believe 3 separate meetings. It has been a difficult process with some setbacks. Some of them just, kind of wrangling with the difficulties of having a policy where we consider telling people they have to leave their homes and camps. And some of just the practicalities of we don't have all the decision makers and authority, so a lot of times our work group is asking, well, who's going to do this and who's the decision maker, and they're not in the room. So it makes it, difficult when we get stuck on some of the things that we aren't able to do. I do think we've had really productive discussion. We have a group that is really passionate about this work and coming up with, a policy that's going to be humane and improve things for our community. And I do think some of the disagreements have been fleshed out and identified. So we are behind. September is going to be difficult, but I think we have 4 parts of the policies, and some of them have been drafted into policy-looking documents, and others are sort of more ideas and principles. So my hope is that at the next meeting we can look at a draft, that those things can be tied together. I'm thinking about trying to spend some time next week kind of putting these things together in a draft and identifying where we agree and where we still have decisions to make, in the hopes that we can bring something, certainly not in 2 weeks, but something to the HIAC in September. So I'm happy to take questions about that.
Any questions? So I have a suggestion, since I just mandated your deadline. I think if it's too difficult to come up with an encampment policy and how it's going to be implemented, I would encourage the work group to focus on what types of policies you would like to see in a final encampment policy. So things like, we believe that encampments should not be closed until there's a place to take people, or something like that. And not worry so much about the who's going to do it, or how it's going to be done, or how many days there's going to be given for this, that, or the other thing, but focus on the broad principles of what we are advocating for, what you're advocating for as a work group. And I know that there are some complexities around public land versus private land. And there may not be much we can say about privately owned land, so maybe we focus on what we think the policies should be around encampments on public spaces. City, county, DOT owned land. So those are just suggestions to help. And you know, we can report out the truth is the work group may not have some of the decision makers that are needed to really implement who's going to do this and how are we going to do it, and if it's a good idea, you know, even if it's workable idea. So we may need to restructure after September.
Okay, I appreciate that, and we certainly do have agreement on a lot of principles, so we'll have those at least to give to this board.
Shelter, any other things on encampment? Okay. Shelter, we have a recommendation. It's kind of long, and I'm not going to read it, but I will. It's not long. It's just a little over a page. But the lead here is that the shelter work group, and we may have buried it in the document, so I apologize for that. But the shelter work group is recommending two things. That we're recommending them to the HIAC, and if you approve, we will all be recommending them to the city and county and Dogwood Health Trust. The long-term thing is sort of toward the end of it, but I want to highlight that we are recommending an ongoing planning process for a new housing first focused shelter serving Asheville Buncombe. So that's the long-term recommendation, and there's a lot more work that needs to happen around that. The short-term recommendation is that we are recommending that those three bodies and whoever else they can identify to collaborate with fund up to $1.75 million to secure a certain number of beds that would meet our needs. This will be operational funding for the most part, and it will create 58 new beds, which is not our goal of 95, but it's a significant chunk or move in that direction. It will support both existing providers and a new group that has been developing itself over the last couple of years in the Code Purple winter shelter space. And it will preserve 30 existing beds at the Salvation Army that are currently, the funding will run out for those on September 30th, if I'm correct. So it'll be the 58 new beds plus 30 existing that were originally included in the inventory that National Alliance did. And if those are funded, my understanding is the Salvation Army believes they can, without additional funding, they could create 32 Code Purple beds over the course of the winter. We can go into the details in more detail. We have the different agencies, Salvation Army, the Safe Shelter Group, and Haywood Street Respite. Both, the first two groups are proposing to provide new beds, and as I mentioned, continue existing beds at Salvation Army. That's primarily operational funding. The last group, Haywood Street Respite, is in the process of developing 3 new beds. This would primarily be to complete their capital work, although I think there is some operational money in there. And these are the closest beds that we have. They're not exactly enhanced beds for people with specific needs, substance abuse and other needs, but they can be accessed by those folks either through a referral from the hospital system or from the community paramedics, if I'm correct about that. So that's my summary. If I said anything wrong about any of your proposals, please correct me. If I left anything critical out, but I'll open it up for questions.
One comment that I have is what Tim shared at an earlier Hyatt board meeting, which is where emergency shelters stabilize individuals so they can make the choice for transitional housing. So these shelters are not long-term, they are more emergency room. And also, can you share the per diem to give people a perspective and maybe compare that with others?
The per diem amounts are different. So I don't want to get down into the weeds on that, but you're correct that these would be high access, low barrier beds that do not come with preconditions to the greatest extent possible. They would be intended to be short-term and move people as quickly as possible into permanent housing options and or transitional housing if that's what the client wanted. Elvia.
So, I think we've already talked about this, for the Haywood Street respite beds in the package, according to how we delegate our funds, from the way we have talked about this in December, all of our packages need to express equity and inclusion. They need to express as to whom gets to sleep in their beds. And that package does not represent that.
So that's, your comment is specific to Haywood Street Respite?
It is.
Okay. Do you want, is there any more?
I think it's a great idea. I think that if that package decides to express those qualities and make that statement, I think that we can do what they're asking. I don't think it does at this second. I think they need to include how that is part of their package. I don't see that detail. And since that is a part of our bylaws and how we decided in the beginning how we were going to require that from everyone who comes to the table, it's not there. And I think would be a fair assessment for everybody who comes through that door to ask us for anything. Everybody else has to do it, and it's not done.
Okay. Any comments or questions around that? Go ahead, Jim.
I don't have a question or comment around that. I'm more just, number 2. I just wonder if there's an ability to revise that to just be funding in general. Feels a little remiss to only list those 3 when there are potential other foundations or funders that could support in our community. So just could.
Yeah, we are trying to, I mean, you can make that motion. We are trying to get a recommendation to these 3 groups specifically for shelter beds that we hope would start on October 1. So I don't know that we will have a lot of time to, I mean, certainly we'll accept, or the groups would accept funding from other funding sources, but I'm not sure I want to list other funding sources in our recommendation. Or we could say something, other funding sources who come forward willing to support. I mean, I don't want us to have to go out to multiple funding sources and see, are you willing to support it? But I think if there are any other foundations who want to come in and say, yes, we want to support this, I think that would be welcome.
And would I be able to respond on the Pickett Street resident?
Everybody okay with that? Yeah, go ahead, Laura, from Haywood Street Respite.
I just wanted to, I guess, offer clarification that this is not the full extent of the proposal. We had a 4 or 5 page proposal that the committee reviewed, and in it we were asked to comment on our efforts at diversity, equity, and inclusion, and we expressed the ways in which we are implementing different types of training for our staff. All of our staff completed the DHHS Understanding Cultural Humility training this year. Last week we had a trauma-informed care training. So we're working at everything's a process, and we're in the process of building our staff's capacity to be more understanding and sensitive to issues of cultural diversity. In terms of our practices as an organization, we have policies and practices allowing transgender individuals to participate with Haywood Street Respite Care, and other ways in which we try to be supportive of folks so just wanted to offer that.
Thank you, Laura. Thank you for being here, Laura. I appreciate that. I asked Laura to be here yesterday because I wanted her to speak to that. I just asked that it be somewhere written in your proposal because I intend for others to have that written into their proposal. When people can see things, I think that it holds you to those things.
And there will be, beyond, if the funding is forthcoming, there will be, specific grant agreements with the funded agencies that could address those issues.
Thank you.
Do you have something, Rick?
Well, I was wondering how that will practically work its way back through HIAC or not. Because it seems like there's a desire from one of the working group members to see in print certain things that conform to the housing first and equity and et cetera. That doesn't exist today.
It actually does exist. It exists in our mission statement.
No, I mean from this applicant. It doesn't exist in their document.
Well, it actually does exist. I'm a board member. It does exist in our documents.
Then I'm confused about the dilemma. I thought you said that you needed it in print in the application from Haywood Street.
Yeah. I think if you come to our meetings and you read our mission statement, then you know that when you submit an application here for anything, it should meet our requirements.
Can I chime in?
Yes.
You know what this makes me realize is that a miss on my part is that we should have included the proposals from these 3 parties in our meeting materials to accompany this work group recommendation. The kind of detailed question that you're asking, Elvia, is the right kind of question, and it is part of what the work group did in their review of the proposals that they received. So what you're getting, what you all as the board are getting, is kind of a condensed version of recommendations the work group, but you haven't had the opportunity to see the full proposals. But the work group has filtered through exactly those kinds of things that you're discussing.
So I guess we would be, the work group would be asking for trust on a couple of issues. One is that we are alert to those issues and will continue to be alert to them, and we'll provide you with copies of those applications if you like. And also so that we can get a recommendation to the city and county and Dogwood before the end of this month for your approval of this recommendation today.
Clarifying, I think. Elvie, the way I was hearing you say it is like, by pursuing explicit language in one of the applications, the intent was to ensure that explicit language for all the applications. Am I hearing you correctly?
Yes.
Okay, so that made me think of our COVID-19 relief funds and the ARPA funds. One of the things that came up is, should we consider applications that we knew might have issues with our non-discrimination ordinances for the city and the county? And so if we were more explicit in our language, it would provide accountability at the front end that we could use throughout the process when we're looking for those equitable outcomes.
Absolutely.
So what I'm hearing you say is you're looking for one because you're looking for it overall.
Yes, absolutely.
So
I
I
feel
appreciate the trust that's requested, but I also am hearing a need for explicit language. Am I right?
Yes, I feel especially in a position because I'm on that church board. And when things don't pan out, even if the best intentions are there, I feel accountable. So I'm asking for specifics because I want to make sure my I's are crossed.
It's like
And my
bringing
T's are dotted.
the dish that you need to be on the table, you're bringing it.
Exactly.
I hear that.
Okay, so under item 2, we're asking for authorization as a work group to negotiate final budgets. And I think we could include some language there and, contractual language related to diversity, equity, and inclusion in the final agreements with
Yes,
the
please.
providers. Okay.
Could there be a language about agreeing to comply with the city and the county's non-discrimination ordinances? Because we already have those in place. We don't.
Yes, if that satisfies diversity, equity, and inclusion, that's one way of looking at it. An equally important goal for us is to make sure that these beds are as low barrier as possible, which, so there could be barriers related to race and other categories that we need to make sure are not in the contracts. And there could be other barriers related to sobriety or some other, and we will definitely make sure that those are not, those barriers do not exist for these beds.
Yeah, I'm gonna try to get out of the fluffiness of the clouds and just be really like speaking from my heart for a minute for young people that I know. When I talk to somebody who's a young trans person who's experiencing homelessness and they're not going inside because there's fear about not being welcome, and also if they are excluded from a service, it makes them vulnerable for them to complain and to use our own complaint processes. So while we were anticipating there would be complaints, there haven't been because people are scared if they complain, they'll lose even more access to resources. So I'm just holding some curiosity about how we really show up for vulnerable people.
We are also working on a grievance committee as well, but I hear what you're saying. With respite beds, there's also, I was curious as to whom is welcome to those beds as well. And so I wanted some language about that as well.
Thank you.
I guess I'm a little confused, but I don't think it needs to be sorted out here. I'll just say what I hope. We are a housing first advocate, and anything on any of these that deviates from that definition weakens our ability to prove that housing first is the way we're going. And somehow, I just want to make sure that that just does, any deviation from that doesn't end up in the legal documents that these people sign up for, because it will then look to the public like there was a deal done not in the public view. And a contract was written and somebody is getting these funds and isn't actually conforming to the housing first approach, which has been, it's at the core of all this hard work we're doing. So I understand the timing, and especially with Salvation Army running out of money, and I really appreciate the urgency. I just don't want bad contracts that let these providers off the hook on that part.
Absolutely. And we don't either, and we will make sure that doesn't happen.
I'll just say again, I think miss on my part to not include the actual proposals in the meeting materials. But I will remind the board, you all, that you did approve the request for partnership that went out to seek proposals. And the requirements of that request for partnership were to provide information about Housing First and about equity and inclusion. So again, the work group did review those materials and vet some of those pieces that you're bringing up.
Any other comments or possibly a motion?
I feel like it's an important discussion, and I feel like subject to final budget negotiations and authorization by HIAC to negotiate, and part two will give us a chance to ensure that. So I would move to approve this.
I'll second.
Any further discussion? All in favor?
Aye.
Aye. Aye. Any opposed? All right, thank you.
David, I didn't object or have any objections to this. I just do wonder about long-term for HIAC, because this is outside of budget cycle for many of these organizations. And so just a thought for the future about how this committee plans to consider that in future requests. Not necessarily for today's discussion, but just a comment.
For next year, we need to start in December. Budget cycles start. All right, funding allocations. Sarah's not here. Do we have any updates?
Yep, I'll share briefly that the funding allocations work group is actively meeting. Their next meeting is tomorrow at 1 o'clock in person here at City Hall on the 6th floor in the training room, where they will hear presentations from ESG applicants and begin their deliberation about recommendations for ESG. They'll meet again next week to finalize those recommendations, and then ESG recommendations are coming from the funding allocations work group to you all at your August 10th meeting.
And we'll segue into COC.
Continuum of care funding competition is upon us. That's how it feels to me. So annually, as you know, HUD publishes the Continuum of Care competition. That has just come out July 5th. We never know when that's going to come. It just comes. So it has come July 5th. And the funding allocations work group will also be handling the Continuum of Care process, very similar to the ESG process, meaning staff will facilitate notice to the community, which we've done. All of the materials are up on our website. We will receive project applications. We'll share all of those with the funding allocations work group. They will review, score, rank those, and then make recommendations back to you all for approval. If you scroll down a bit. So you can see the funding availability there. Our annual renewal demand, which means if our current funding was renewed at 100%, we would be eligible for just over $1.8 million. HUD every year announces through the notice of funding opportunity the percentage of that annual renewal demand that is available in Tier 1. This year, that's 93%. What that means in layman terms, it's very complicated money. What that means in layman terms is that we're highly likely to receive all of the projects that are in Tier 1, so highly likely to receive the 93% of our renewal amount. That other 7% of funding will fall into Tier 2, which is much more competitive across the country. It's scored differently. The scoring in Tier 2 relates directly to the overall performance of our continuum of care, not only the quality of those project applications, but the overall system performance within our COC. Additionally, if we are competitive and are awarded those Tier 2 funds, we additionally want to be competitive in order to have a chance at increased funding. Increased funding comes through bonus projects, and you can see the amounts that we're eligible for there. A continuum of care bonus project is the same eligibility as all of our current renewals, all continuum of care funds. And then the domestic violence bonus is, of course, specific to projects that serve people who are fleeing domestic violence or survivors of domestic violence. And then lastly, we're eligible for a non-competitive collaborative applicant planning grant. So the city is eligible for that. That's essentially admin money that comes along with the overall funding, but isn't part of that ranked or evaluated process. The timeline, I believe, is on here. Again, all of this is, yep.
I really appreciated that you had 2 opportunities for those applying to kind of get feedback and information. That type of guidance, I'm sure, is invaluable.
Absolutely. Again, federal funding is complicated funding, and in our division, we want to be sure that people have the tools and resources in order to understand how to access that, and we want to be a help. So yeah, definitely want to make those opportunities available. Letters of intent to apply are due on August 9th, and then project applications are due August 23rd. Funding allocations work group will hear presentations from applicants on August 29th, and then deliberate, make their recommendations at a subsequent meeting that is scheduled but is not listed here, and I don't remember the date. And then they will make recommendations to you all at a September 12th meeting. I had reached out to you all about ensuring that we have that September 12th meeting. When HUD publishes the notice of funding opportunity, there's a firm deadline, which you can see there is September 28th. And also, there are specific timeline requirements in that NOFO. So for example, we're required to let project applicants know what your decision is about their funding recommendation at least 15 days prior to that final submission deadline. So for that kind of reason, we had to back out our dates based on those NOFO requirements, which is why we requested that meeting of the board on September 12th.
Can you go back to the list of dollar amounts? Is the 5% for collaborative applicant planning included in the 1.72 million?
No.
No. Okay, it's an addition. All right, any questions about this? This is just information for right now, but there is one thing that we need to kind of decide, and that is, or we don't have to, but our normal meeting would be September 14th. We need to do it a couple days earlier to meet the HUD deadlines, and we definitely need to have a quorum at that September 12th meeting. It's going to be critical. So the meeting will be on September 12th, and if anybody anticipates not being available, please let us know ASAP so that we can figure something out. The question is, should we also have a September 14th meeting, or should we handle all of our business on September 12th?
One meeting sounds good for that week.
second that, one meeting.
The third option would be to have 3 meetings that week. But it sounds like we're leaning toward one.
Motion strike.
All right, so by consensus, we'll just have the one, we will cancel the December 14th meeting. And we've already called a special meeting for, or I have already called a special meeting for September 12th. Okay, public comment. We've stunned the public into silence. All right, our next meeting is in 2 weeks, August 10th. There will also be some important items on that agenda, so look forward to seeing you then.
Yeah, can I jump in to, again, say, just to echo what David just said about the importance of quorum at the August 10th meeting? We need you all to vote on those ESG recommendations in order to submit those by the state deadline. So quorum, very important at that meeting as well.
Thank you. We're adjourned.